Jaghu maternal and infant program at West Moreton are recruiting to a number of positions to help meet the needs of the community. We encourage you to contact our service and invite you to become a part of the Jaghu family.
I've chosen to work for Jaghu because I'm very passionate about my mob. I'm very passionate about First Nations midwifery care. And the only way to create change is to nurture and support our families and our women and our babies. And I feel like at Jaghu we're enabled and encouraged and supported to provide a level of midwifery and postnatal care to our families that we just can't otherwise do within the main hospital system.
I find I have enormous job satisfaction working here. I go home pretty happy with the work that I've done every day. I come back to work excited about what I'm going to be doing in my day. So for me, it is all about work satisfaction, job satisfaction, and the work that I get. I guess I'm lucky enough to be involved in helping mums and families. I guess reach somewhere in their life that they want to be.
Like I said, I'm a mother of two, so I really need flexible work agreements. So, I think every workplace needs to have that understanding that, you need that work-life balance. I think that's very important.
When you talk about the cultural environment, cultural safety, it is imperative that we do have identified staff within our identified roles to deliver our services, which really does put a whole different level of that cultural safety, and also to have them comfortable to come into the service. No one talks to our people like we do. We provide I guess that family kind of feeling when they do come into the service.
So with Jaghu, we give the opportunity for someone to tell their story rather than just bring them in with a very formalised orientation program. Even though that's important, it's also important for someone to come into a space such as Jaghu and just be comfortable. One of the main benefits for me is Jaghu offers not only a very flexible and adaptive program to our women, which I love, it also does to the staff, so it's widely recognised that midwifery in particular is often a woman-centred profession. So to be able to sort of be flexible and have work-life balance is encouraging, for women. It welcomes women more, and it gives them the ability to, do something they love combined with raising their family.
The amount of First Nations staff in this hospital and this West Moreton district is incredible, and it's nice to be able to see fellow Indigenous staff there and know that they're on the same journey as you, regardless of what areas we work in. But having a First Nations midwife and support staff where I sit, and we're across the board of different health specialists, it makes a big difference to me coming to work and then wanting to achieve more. And then when you talk to your manager who's also First Nations, you sort of got the same goals and where you want to go for our community, and you always want to aim for more and become a leader in the community so that people in the community can see us in higher value roles.
The main benefits is working in a new model of care that's really growing and thriving in an environment where it is really needed. So we know that Ipswich is really fast growing, and our population of First Nations people is growing as well. And it's an area that hasn't had a lot of focus on in previous years. So to be a part of something from the ground up and really to help grow and mould the service to support the needs of the community, I think that's really exciting.